Hi, I'm Dr. Ann Peters, and I'm here today with Dr. Bruce Bodie, and we're going to talk about exercise as part of the treatment for diabetes. So let's start the discussion. You and I both take care of lots of athletes. How do you teach someone how to take care of somebody who's taking insulin?
Sure. As you know, exercise is a insulin sensitizer. It makes insulin work better. So like in type 2 diabetes, you always want to get your patients to walk because it improves insulin action. So in type 1 diabetes, they don't make insulin, but they got to take insulin to survive. And you have to balance the insulin to your food intake, and when you exercise, you're going to need less insulin because you're going to improve insulin action and sensitivity. So for people who want to exercise with type 1, which they all should do, and if they want to get into extreme exercise like running a marathon, you have to help them and guide them. So you really have to balance, you have to have the right amount of insulin on board with the right amount, and you match with carbohydrates as best you can. So the rule of thumb is you always start exercise when your glucose is above 90, and preferably don't start exercise if your glucose is above 250, because that means you're relatively insulin deficient. And if you're starting at 90, before you start, you might want to take 10 or 20 grams of carbohydrate, some even juice or something. And then the key is you need to monitor the glucose in response. If somebody exercises, just like an aerobic exercise, a run or walking, and over time they're starting to fall, that means they have too much insulin on board. You got to cover that with carbohydrates. And the rule of thumb is for every 30 minutes of exercise, you need between 15 to 30 grams of carbohydrate. And they can do it as a drink, you can do it as a bar, whatever you want to make up. You don't need any fancy food or anything. And the other issue, that's while exercise. Then after exercise, you got to make sure they aren't going to go low, because all of a sudden your insulin action has improved dramatically. And the rule of thumb is if you're exercising more than 45 minutes, you need to replenish your glucose stores. And how do you do that? With exercise, you've depleted some glycogen from your muscle, also your liver, so you got to restore that. And a rule of thumb is you need to restore that anywhere from 40 to 80 grams of glucose after exercise. If it's been over, especially strenuous exercise like cycling for 50 miles, doing 5 or 10K, you'd need to replace it. So you always replace your glucose with carbohydrates. It doesn't matter what carbohydrates.
So a favorite carbohydrate of my college students are peanut butter and jelly sandwiches. Do you have a favorite food snack that people have after exercise?
So I think peanut butter and jelly's fine. You got the two breads on each side, you got the jelly, you got the protein.
Simple, good, and generally not something people can eat with diabetes. Yeah. Do you have them take insulin for that, or just eat the carbs and test later? Yeah,
so the rule of thumb is you need to know where your sugar is. Ideally, if you have a sensor, you can really tell. If your sensor's going up, you obviously need to take insulin. If your glucose on the sensor is going down, you might want to cut back your insulin, but you still got to cover that. And so we typically cover it at about initially 50% of your usual. So let's say your peanut butter and jelly sandwich, you're going to take normally 8 units for. You might take 4 and see what happens. And then you learn individually what works for you.
Well, so that's key, is trial and error, because not every person's going to be the same, and the adjustments before and after exercise are going to be different. Now, I have some very specific questions. Is there a time of day, if you could write the prescription for exercise, is there a time of day that you'd prefer someone exercise?
Well, obviously exercise is good, so whatever works best for them. But if I had to say what's better, would be in the first half of the day, because the second half of the day is going to affect your glucose in the middle of the night. Now, if you have a significant other there, or if you have a pump that shuts down when you go low, you're fine. But if you live alone and you're prone to hypoglycemia, that can be dangerous. So you always want to make sure when you go to bed that you've eaten. The last thing you want to do after exercise, you went out with your friends, said, let's go celebrate and drink. And that's a bad thing. You had a soccer game, now you're going drinking at the bar, and you don't eat. You can have a severe hypoglycemia.
Well, but that's why I always tell people to eat and drink at the same time. I want them to go out for a beer if they want it, but they've got to understand that risk.
Yeah.
So I do find the time that is the hardest for me to help people manage is if they want to exercise right after work, when, as far as I can tell, everything's at a nadir. Their cortisol's at a nadir. They are hours away from lunch, and they're going to eat dinner after exercise. I often run into trouble there. So let's just say your patient is exercising at 10 in the morning. Everything's going well. Is there a type of exercise you'd recommend, or a pattern, or what's the general focus that you would have?
So really, as you know, there's different types of exercise. There's aerobic, like walking or jogging or running. That's aerobic. There's anaerobic exercise like weightlifting, and there's episodic exercise like sprinting, and that's very anaerobic. Anything anaerobic will bring your glucose up. A sprint, going just out playing hockey. You go out in a hockey rink and you're going all out for 90 seconds. Your glucose is going up, and that's very hard to control because of your adrenaline. But aerobic, your glucose is being picked up by the muscles all the time because your adrenaline is not as high as that. So obviously it's where your glucose is. If you're saying I'm going to go on a long walk, you could truly sprint to bring your blood glucose up by 50 points and then walk, and then you see it gradually go down on a CGM. But the key here, you always need fuel. Your fuel is glucose. And if you've eaten recently, you're fine because you have fuel there. But if at the end of the workday and you have no fuel on board and you're going to go do something like you bike 50 miles or whatever you're going to do, or walk, you're going to need some fuel, because if you don't have enough fuel, you either go low, or if you don't have enough insulin, you go high and you get lactate, and you just
your muscles hurt and you don't feel like it. So yes, key is to make sure patients always carry fuel with them, because I've had a patient or two, knowing what we're talking about, who's gone low or going low and they don't have food and they sprint, which is not something I recommend here because it's not how you want to treat hypoglycemia in this setting. But so I have patients who try to follow my advice, and what you're saying holds. They go do some sort of exercise that's anaerobic, they lift weights, or they play even something like tennis where they're being very competitive and their sugar is high after exercise, and they say, gee, that's the wrong effect. But I tell people, and I'm sure you do too, that exercise is good for you, and we just have to pattern out what they need to do in terms of their insulin dosing. Yeah,
very much so. In post-hyperglycemia after exercise, very common. You have a lot of adrenaline. You have all of this. You've been playing tennis hard, and your glucose is high. You don't have enough insulin on board to drive it in. And this happens a lot even in cyclists after a race, especially these short races. What we have them always down is cool down. So after exercise, you want to keep your muscles moving. You just sit down and don't do anything. You should walk. If your glucose is high, and your muscles will pick up that glucose, you hydrate. And by doing that, you're sending that glucose back into the muscle, back into the liver. You're rebuilding your glycogen stores, and that's crucial. And then if it stays high, you need to take corrective dose insulin.
We forgot mentioning hydration is key here. Getting dehydrated is the enemy of everything we're trying to do. So hydration, through races, through training, through whatever, I think is vital. So give me an exercise prescription to give to a patient. Say it's a 35-year-old person who wants to start exercising, they're taking insulin. Tell me in 1 to 2 minutes exactly what you would tell that person to do. How often do you want them to exercise? What's your prescription for exercise?
So if you haven't been exercising at all, I think the easiest thing to do is walking. And you can walk, and if you want to join a gym and get a trainer, that's fine too. Same thing, and they'll work with you. You want to know what your glucose is going in. You want to measure it, and you want to record it and remember. And then as you're exercising, you want to see what direction you're going in based on that exercise, so you know what to do and how to handle it. So let's say you're doing walking, and every time you walk, your glucose seems to drop 50 points. That means you have a good amount of insulin on board, That means you need to either take carbohydrates as you exercise, and typically the rule of thumb is 15 to 30 grams every 15 to 30 minutes. Or if they had eaten before, you can cut the insulin down, because a lot of people want to exercise says, I want to lose 5 pounds.
Right, they don't want to eat all these extra carbs.
Yeah, so what you do is you purposely reduce the insulin by maybe 50%, and that'll give you the ability, that'll offset, so the glucose won't go in your cells, then it'll give you enough glucose to exercise and preserve fuel during exercise. So it's this balance, but you have to monitor your glucose, look what happens before exercise, after exercise, and then 4 to 6 hours later after exercise.
Right, to look for the delayed hypoglycemia.
Yeah, and it's always better to always eat some within 4 to 6 hours before exercise. You don't want to go in, I haven't eaten all day, let's go. You have no fuel.
Right, it's always about the balance, insulin, exercise, fuel. You just have to make it work out, and it takes trial and error, but I think that as physicians we can really help our patients achieve what they want. I know you and I have both worked with elite athletes who've done all sorts of amazing things, so this isn't necessarily a barrier, but it's often perceived as a barrier, but working with one's healthcare team I think can make a big difference.
There's no question about it. You should allow people to do whatever they want and learn how to balance it.
Exactly.
And I think sensing, continuous glucose sensing, hopefully will become standard of care in the next few years.
I hope so too. All right, well, thank you very much. And this has been Dr. Ann Peters for Medscape. Thank you.